Good morning, everyone. We'll start today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, we are also joined by Dr. Edmund Jackson, Chief Data Officer at HCA Healthcare, and Dr. John Graves, Associate Professor of Health Policy at Vanderbilt University School of Medicine. Director Chief William Swan of the Office of Emergency Management at Nashville Fire Department, Chief Steve Anderson of the Metro Nashville Police Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Now, we're known around the world as Music City, USA. Nashville is also lucky to be a healthcare industry capital. And in fact, more than 500 healthcare companies have operations in Nashville. Now, two of our major healthcare partners providing care to thousands of Nashvillians and fighting COVID are HCA Healthcare and Vanderbilt. And these two companies have modeled the path of the virus and are here today to talk about their findings. Now, I'm glad to welcome Dr. Edmund Jackson, HCA's Chief Data Officer, who's joining us remotely to discuss HCA's COVID-19 model and what it might tell us about how our efforts to flatten the curve are working in Davidson County. I'd also like to welcome Dr. John Graves, Associate Professor of Health Policy at Vanderbilt University School of Medicine, who is joining us remotely as well to discuss Vanderbilt's COVID-19 model. Now, I'm grateful to both Dr. Jackson and Dr. Graves for lending us their expertise this morning to inform us of our progress in flattening the curve of the coronavirus in Nashville and Davidson County. Now, I've asked them to join us today because their respective models are specific to Nashville, and I want you to see the science behind the social distancing efforts and the public health policy choices. Now, your commitment to social distancing is having an effect, and you will be able to see that on our local COVID-19 curve. Now, one thing to keep in mind is that we cannot let up our efforts after the day that we peak. The peak represents the highest number of people infected at one time, which is then reflected in hospitalizations and the challenge to our health system's capacity. But the peak is not the end. Now, we have been acting to lower the number of cases at our peak and limit the duration of the COVID-19 outbreak in Davidson County. Now, our efforts are working, and that's precisely why we should stay the course. That means continuing to stay at home and practice social distancing. Now, yesterday, the Tennessee Department of Health informed us that the vendor it uses to collect COVID-19 data had a computer failure that impacts all local health departments statewide, and as a result, we are unable to report new confirmed cases until the Tennessee Department of Health finds and fixes that problem. And we will provide an update as soon as this issue is resolved, but in the meantime, the Metro Public Health Department is making all available efforts to gather all the COVID-19 patient data it can from our local health care partners, and Dr. Jahangir will share the locally collected data. Now, to my fellow Nashvillians, I know that we are facing an incredibly challenging time, and we have for many weeks now. But today, 18 days into the Safer at Home order, we continue to see very strong compliance by both residents and businesses. Our enforcement teams have been able to bring businesses into compliance without issuing a single citation or fine. Your efforts are making a difference. Now, Nashville is responding to this crisis, as we always do, in solidarity with one another. We will get through this together. Our economy will come back, and we will be a stronger community in the end. And for those who are in need of a helping hand, though, in this difficult time, please visit our website at covid19.nashville.gov. There you will find links and helpful information on obtaining direct financial, mental health, food, and social service assistance through the COVID-19 Response Fund and our local community partners. Now click on the How to Stay Healthy link to find tips on protecting your mind as well as your body during this time. And of course, if you're experiencing a mental health crisis, there's round-the-clock assistance available through the Mental Health Cooperative's 24-hour crisis line. And that phone number is 615-726-0125. Now, as a reminder, Metro's tax relief and tax freeze deadlines have been extended to July the 1st. And call the trustee's office at 615-862-6133 to learn more about these important relief programs available to Davidson County taxpayers. Now, I continue to urge everyone to wear face coverings in public settings where other social distancing measures may be difficult to maintain. You can donate homemade masks to the Community Resource Center at 218 Omohundro Place, Monday through Friday, 9 a.m. to 3:30 p.m. Now, with that, I will turn this over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning, Nashville. As the mayor just said, yesterday the Tennessee Department of Health informed us that the vendor they used to collect the COVID-19 data had a computer failure. And so while this information is not available from the state, the team of the Metro Health Department has been working tirelessly this morning to compile information, and I'm happy to report, as the mayor was speaking, I was just handed some information I'd like to share with our community. We had one additional death report yesterday, bringing the total death to 13. I express my deepest sympathies to this gentleman's friends and family. We have a total of 1,231 COVID-19 cases in Davidson County, and that's an increase of 91 from what we reported yesterday. And based on my conversations with hospitals this morning, we are showing 59 individuals currently hospitalized in Nashville, and that's an increase of approximately 7 from 2 days ago. Now, if we get more information formally from the state before tomorrow's press conference, we'll make sure to put out the updated information on our website, covid19.nashville.gov, as well as send a release to the media. Yesterday, the 3 community assessment centers were open at Nissan Stadium, the Old Kmart on Murfreesboro Road, as well as Meharry Medical College. 226 people were assessed yesterday, and 152 people were tested for the virus. Since last Monday, our assessment centers have screened over 1,500 individuals and have tested nearly 1,960 to be exact. They are open to all Nashville residents, and there's no cost, even if you need a test. The wait times continue to be under 10 minutes for the assessment and the test, and the results have been returning within 1 week. The assessment centers will be open again tomorrow from 9 a.m. to 3 p.m. In addition, yesterday, 238 people called our assessment hotline, and since March 27th, 4,285 people have called the hotline. The wait times for the hotline are less than 1 minute, and if you think you're having symptoms, please call our hotline at 615-862-7777. This hotline is open 7 days a week from 7 a.m. to 7 p.m., and the phone lines are staffed by medical personnel. The hotline and the centers make up our community assessment system and increases our capacity as a city to assess and test our individuals here in Davidson County and ease the pressure off of our healthcare system. As the mayor said, we will have representatives from HCA and Vanderbilt here this morning to speak about the modeling and the progression of the virus in Nashville. While this modeling may give us encouraging news, we must remember that we are not yet at the peak of this virus. We are still in the upward part of the curve. It is important to remember the peak is the highest point at which people are infected at a single moment in time. From there, the number will start declining, but people are still infected. And just because we hit the peak does not mean that we are over and can go back immediately to normal. We will still need to stay at home after the peak, and we will see, and as we see sustained decline in cases and as we broaden access to testing, we will begin easing up restrictions and starting to get back to what we knew before. We may be apart, but we must come together to combat the virus. That means we have to stay vigilant and we have to stay the course. Stay at home, go out if absolutely necessary, and plan ahead and make less frequent trips you need for essential items. I'm grateful to all of you for your perseverance and dedication. And with that, I'd like to introduce Dr. Edmund Jackson, Chief Data Officer for HCA Healthcare. Thank you.
Thank you, Dr. John. Jahangir. As you can imagine, at HSA Healthcare, we run 165 hospitals across the nation. The role of modeling has been absolutely critical in predicting, managing this crisis. And we've been using a couple of different models in order to do that. The first is a model created by Chris Murray and his team at the IHME. This is the model that you've seen in the news that Dr. Fauci, the White House, and many governors across the nation are using to predict the progression, peaking, and eventual decline of this pandemic. Now, that model is based on the experience in Wuhan, in Italy, and Spain, and often, well, in its most recent incarnations, is very deeply affected by the timing between social policies being put into place and the peak of the pandemic being reached. That's a really great model. The second model that we're using is internally developed. At HSA, we have a tremendous privilege of serving patients from Florida through to California. And so we've seen the progression of the pandemic in various different phases. And what we've seen in one place, we can learn from and apply in another. In particular, we saw early outbreak in California in the San Jose market, and we've been monitoring that very, very closely. Now, there's a very big difference between the case count of COVID and how that translates into the load on the hospital system. In particular, people in ICU, and beyond that, people requiring ventilators. That's the key thing that we need to manage. When we hear in the news about bending the curve, that is what the resource is that we're trying to protect. So here's the good news. The pandemic that we were originally expecting, the curves that were originally being predicted have been brought down. The sensible policies, and more than that, the adherence to those policies by the citizens of Nashville and across the nation has brought that curve down to a point where we're actually able in Nashville right now to keep up with the pandemic. So here's the story. I'm not a clinician. I'm a doctor of data, and I can only tell you what the data says, and it says this. Social distancing is working. We have this within our ability to manage so long as we continue to adhere to those policies. So from our frontline workers, from the rest of Nashville, thank you for doing so. Please continue to do so, and together we'll overcome this. Thank you, Dr. Jahangir.
Thank you, Dr. Jackson. Next, it's my pleasure to introduce Dr. John Graves, Associate Professor of Health Policy at Vanderbilt University School of Medicine and member of Vanderbilt's Health Policy and Public Health COVID-19 Advisory Panel. Dr. Graves.
Thank you. I'd like to share some slides on my screen if I can get control here. So I think the question on everybody's mind is there evidence of moderation in case growth in Tennessee and Nashville specifically, and when can we start to think about next steps in controlling this pandemic? What we've seen from the international experience is that countries that have successfully curbed the epidemic, at least in this initial phase, have done so through a combination of social distancing and widespread testing. What I'm showing you here is what we're calling our ejection plots. And these are plotting the case series data a little bit differently than you might be used to. This line is tracing out a trajectory over time for South Korea. And what you can see is the initial phase of the epidemic, case growth, daily case growth, grows at an exponential rate. And then the effects of social distancing and other policies set in, and all of a sudden, the country ejects off of that initial trajectory. So the question is, what are we seeing in Tennessee? What the actual data as of yesterday afternoon show is that Tennessee followed a similar trajectory as almost every other geography across the world. And we're finally seeing, as a result of the social distancing now being practiced by many of our fellow Tennesseans, evidence of Tennessee at the statewide level starting to remove itself from that initial exponential trajectory. Now let's ask the question of what we see here in Metro Nashville. In fact, we see that a lot of the moderation in case growth across the state has been seen as well in Metro Nashville, even to a somewhat greater extent. So this is really good news, demonstrating proof of concept that the social distancing practiced by our citizens is having an impact and reducing our case growth to levels that would not be predicted by an exponential growth model, at least as we were experiencing it even 2 or 3 weeks ago. Now, what I'll say here is that South Korea is a nation of 50 million people, 52 million people. And so the case growth that they're seeing is substantially at a population level, substantially lower than what we're seeing here. The question is, how do we predict this forward so that we can start to think about next steps in terms of controlling the epidemic? Over the last several weeks, a team at Vanderbilt of epidemiologists, health economists, health services researchers, and clinicians has been developing a model that's very unique to Tennessee. It's calibrated with actual Tennessee data, and it learns as the situation in Tennessee changes. And so we're able to use that model to predict Tennessee's specific needs moving forward. We're currently modeling 3 scenarios because we can't know exactly what that trajectory will look like over the coming weeks and months. In our most optimistic trajectory, we assume that the recent gains that we've seen from social distancing continue through April and May. In that case, the model is predicting an epidemic peak, at least of this initial phase, in early to mid-May, with 2,000 to 3,000 COVID patients hospitalized statewide at peak, compared to the roughly 500 that are hospitalized according to the state today. Under a slightly less optimistic scenario, we're assuming that the progress that we've achieved so far maintains throughout May. In this case, the initial wave of the epidemic peaks in June, and our hospital system may be stressed to capacity. In a third scenario, we project forward where we lift social distancing prematurely without widespread testing and contact tracing in place. In this scenario, the epidemic overwhelms hospital capacity by mid-May. You can see here that there are a lot of unknowns and a lot of different trajectories that the state and Nashville can take. What's critical that we take away from this modeling work is that the importance of social distancing continue until we reach a sustained drop in cases, as we've seen, for example, in South Korea. At that time, we have to think about this like a multi-stage relay race, where social distancing can begin to pass off to the next leg of the relay. And that means reliable and speedy testing and contact tracing. Absent that, we risk having an epidemic surge out of control once again. Thank you.
Thank you, Dr. Graves and Dr. Jackson, for joining us this morning. We'll now start the Q&A portion of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Stephen Elliott. Stephen?
Hi, thank you. I was wondering if the representatives from HCA and Vanderbilt could answer whether they think we're testing enough right now to inform their models.
Dr. Graves.
I would say the short answer would be no. Our model has to assume that only a fraction of people who are infected have been tested. And we've seen some delays and stalls in testing over the last month or so. So I think we're definitely not at the place right now where we have that widespread testing that would be a necessary condition to start to relax social distancing.
Dr. Jackson?
Yes, I'd agree with Dr. Graves on that. The testing is critical in order for us to understand when it's safe to relax some of the social distancing and be able to detect an outbreak fast enough to be able to control this moving forward. So more testing is good.
Thank you. Tosin Fakile, News 4.
Good morning. Thank you so much for bringing this information to us. So based on all the data that's come out now, I guess this is a question for either the mayor or Dr. Jahanger. Does this mean this safer at home order will still be in place for a long time to come? So end of April, maybe beginning of May? And if so, do you think this economy can survive that? Like, people are already suffering enough, businesses are suffering. I guess, what's the next step based on all this information we've been given?
Dr. Jahangir?
Thank you. As you know, April 24th is when the current safer-at-home order is set to expire for the city of Nashville. What's important for us is that you all know the things that we know, and that's part of the reason Dr. Graves and Jackson are here today. we'll continue to evaluate this as that date gets closer. But what we don't want to do is prematurely release some of the tactics that have helped keep this fire down. Again, I use the analogy, this is like a wildfire. We're getting the fire under control, and you need to make sure you have the ability to surveil for brush fires that happen that you can squash quickly so it doesn't get back to the point of where it is now. I hear what you're saying about the impact on the economy, and we're looking at that as well, but we need to make sure that the science drives what we do. Thank you.
Peter White at the Tribune. Mr. White.
I have two questions. I'm not sure whether Dr. Caldwell or Dr. Jahangir could take them. Either one doesn't matter. One question, I want to know if there's any news on the demographic data that people said they were looking at in terms of Nashville COVID cases, the ethnicity breakdown. And my second question is has to do with the actual disease and the deaths in terms of the counting. Are we, and then actually I have a third question about the virus. That one actually is easy. If the host dies, does the virus die? That's one question. And then in terms of the undercounting, I'm concerned that we're only counting people that have been tested for COVID, and if they test positive and then die, then they're counted. But what about people who die at home that were never tested? Do we have an estimate of those numbers? Thank you.
Thank you, Mr. White. Dr. Jahangir.
That's right. Thank you. Regarding the update on the demographic information, no, I don't have an update for you right now. We're working tirelessly on that, and I promise you as soon as I have it, you will have it. Regarding the question of any virus, I mean, any virus lives inside of an organism, whether it's a human or an animal. When that organism no longer is alive, the virus typically will die at a certain point. So that's just generality of virus virology. And then the third question regarding deaths reported, we rely on what the medical examiner and the physician who calls the time of death or reports the death. Whatever the diagnosis is that is reported on the death certificate is how we determine if a death is COVID related or not. So those are my answers. Thank you.
Chris Treckman.
Good morning. Thank you guys again for doing this. I have a question for Mayor Cooper, two questions actually, kind of tying into my colleague Tosin and what she talked about the economy. The state released their unemployment numbers this morning and showing that in the end of the week of April 4th, 112,438 new claims for unemployment went through. Again, over the last 3 weeks, we've just seen this number keep going up. Mayor Cooper, what are you hearing on a local level in terms of people and unemployment and just some of the concerns they're bringing to you? And then I know that your office tweeted out yesterday, you talked about this a little bit earlier, about some form of relief in the form of a federal grant that will allow families with higher incomes to qualify for help with utility payments. Could you please elaborate on that, just in case people don't have access to the internet? And then also, does this include relief for those looking for money to help pay their rent as well?
Mayor Cooper.
Thank you, Chris. Well, the unemployment figures are devastating. I mean, this is going to be the worst in 80 or 100 years, also the sharpest. And that's why we're so focused on trying to get this under control and over with so we can get back to normal. The best thing we can do is to try to get this over with. The concerns that I have heard locally is, one, it's devastating, and two, this is the right thing to do. That employers want to protect their customers and their staff, and the only way to do it is just to get it over with and get the disease under control. Now, in terms of federal grants, I would encourage your audience to begin to do things like go to Hub Nashville on the web and begin to be linked up with this very robust set of federal grants and programs that hopefully can alleviate some of the stress that people are having. Now, locally, because of the tornado, in terms of utility payments and assistance on utility payments, those programs are in place and working. In terms of unemployment insurance, those claims are being processed by the state as quickly as possible. But there are going to be other programs, particularly small business needs to be aware to contact their banks or go through Hub Nashville to be referred to get some federal assistance, which again, a $2 trillion bill was passed within the last 10 days. It's not completely understood how people can get direct help on that, but let's start. And so the first thing to do is go to Hub Nashville and get directed into an area of federal response that may be very helpful to you and your family.
Brett Kelman at the Tennessean. Go ahead, Brett.
Hi. I have about 1,000 questions for John Graves, but I will start here. Under the status quo track in your modeling, can you tell us about the estimated statewide peak, hospitalization numbers, and projected deaths?
So we'll be releasing a full briefing on that on Friday. I forgot to mention in my comments. Under the status quo, what we're assuming is the transmission number, which is the average number of individuals that an infected person infects themselves, remains at its current estimated number, which we're estimating for Tennessee to be about 1.4. So to get the epidemic under control, you need that number to be below 1 for a sustained period of time. So if we continue at a transmission number of 1.4, we're estimating a hospital capacity to exceed that 2,000 to 3,000. It could be upwards of 5,000 if we don't get that transmission number under control.
A follow-up question for Mr. Graves.
Dr. Graves. I didn't understand that. The cases were going to exceed hospital capacity, or hospital capacity was going to exceed the cases?
Well, the hospital capacity numbers is changing every day with the surge capacity that's putting through. So what our model is doing is projecting a total number of occupied beds in the state. And the number I just described under our most optimistic scenario would be that the number of occupied beds in the state is about 2,000 to 3,000. If we don't continue on the trend line that we've seen recently and stall out at about 1.4 for that transmission number, then the number of occupied beds in the state would get closer to 5,000. Now, if you look at the University of Washington model, they use a capacity threshold of about 7,800 beds total across the state.
Nancy Emmons.
For Dr. Graves, thank you for your work on this. I appreciate it very much, and so does our community. Can you talk a little bit more on the issue of beds, especially the Music City Center? Do you anticipate needing those beds now or not needing those beds? Can you go through the numbers again, if you don't mind, sir?
I'm going to ask that we wait until we're releasing a major report this Friday, where we can go through those type of assessments in a little bit more detail than I can do here. What I can tell you is what was on the slides, which is that in our most optimistic scenario, there would be 2,000 to 3,000 hospitalized COVID patients. And under less optimistic scenarios, that number could exceed 5,000 in our most pessimistic scenario, where social distancing is prematurely lifted without contact tracing and widespread testing to take its place. So I will defer till Friday where we can make a little bit more precise answer to that question.
And our last question comes from Nayeli Alamia with 96.7 FM.
Hi, good morning. My question is, I have a couple of questions. When someone has been tested positive and do their quarantine at home for 14 days, what is the process afterwards? Are they being tested once again, even though we are in low of supply for testing? That's one of my questions. Another question that I have is that some women who are pregnant are wondering, like, when they give birth, is the child also birthed with, or do they also have COVID-19?
Are they tested twice, and then what, pregnant women?
Thank you. Good hearing from you today. In short, no, a person is not tested anymore to confirm that they no longer have the virus. You are cleared of the virus when you are, it's been a minimum of 7 days, and you're asymptomatic for 3 days. So so if that takes you 11 days or 14 days, that's how you're cleared of the virus. Regarding the transmission of a mother to a child, to my knowledge, that's not happening. Now, as we've reported previously, there's some 1-month-olds and 2-month-olds that tested positive. So a mother, once the child has been delivered, and the child can get sick just like any other virus that the mother or any family member can transmit to the child. But to the best of my knowledge, I've not read about or heard of maternal to fetal transmission intra-utero. Thank you.
Thank you, everyone. A recording of this press briefing will be made available later this afternoon. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs,